Hi, I'm Dr. Jha from Renew Clinic in Leamington Spa. Today we are meeting this young man who is 18-year-old and he has consented to come on the video. He's coming to us for a wart on his right elbow tip, which he has it for the last 2 years. He tried some over-the-counter products, but that hasn't helped. Of course, most of these over-the-counter products, they are good and simple treatments, but one has to be consistently applying these products for several weeks and then rubbing them off with pumice stone. And trust me that one will succeed if there is a persistent use of these products. These products mostly are acidic. If you look at these boxes or the bottle carefully, there are some form of acid, weak acid generally, not strong acid, a weak acid enough to burn the top layer of the warts and so on. If they fail, of course, there are other options to try, including cryo, which is available in most of the GP surgeries. So if you have a wart, you're out there, you're watching this video, so you know you need to see your GP to see if they can help you with cryo. Cryo also needs repeated treatment sessions, and cryo is basically a thermal damage. So it works on the principle of thermal damage, where a freezing cold liquid substance is sprayed on top of the wart and it causes surface injury or surface damage, and then repeated damage will shrink the wart eventually and the wart will vanish. At Renew Health Clinic, we treat the warts a little bit differently. We have two modalities or two methods of treatment. One is ablative treatment, which is suitable for young adults or older people, but for children we reserve pulse dye laser, because pulse dye laser is more kinder and more gentler treatment. There is no pain involved, whereas carbon dioxide laser or ablative laser, there is injections to be given before we carry out the laser. But the good thing with the laser for an adult person who has a wart, that you just need one visit to us or any other clinic who are offering the ablative laser treatment. Only one visit. You come with warts, you go home without wart, and wound generally heals within 7 days time. And when it heals, there is a complete restoration of the skin crease, skin texture, and the skin quality. So if it hasn't restored the skin quality and the skin texture and skin crease, that means we have been messing around, which is unlikely the case. But having said all that, there is a small failure rate, and you've got to be aware that one may need a second treatment if there is a recurrence. At Renew Health Clinic, we treat these warts, recalcitrant warts, which are notorious. They tend to come back, or they're very resistant to any form of usual form of treatment and so on, with ablative laser, and they generally are good and effective. Let me show you the wart of this gentleman. So here is the wart, very stony hard, white in color, and I'm going to vaporize it with the laser, but we'll also take a little bit of biopsy to confirm the diagnosis. I hope that helps. Thank you very much.
Thank you.
I'm back again. This is Nicholas. He had an elbow wart, and I've shown you the picture. He also had the treatment now, and here he is. Mom has seen the process that he's gone through, and she's also seen the immediate after results. So I'm going to ask the mom a few questions in relation to what is her thought on the procedure that Nicholas had. Tell me, Mom.
I'm impressed with the steadiness, that you didn't speedily remove it, you slowly did it, and when I've seen the finished result, I'm very impressed by how it looks so far.
Okay.
It's going to heal well.
So you notice there is no active bleeding in the wound.
No.
The wound looks absolutely spot on, clean, and it just looks like a scratch in the
Yeah.
back of the elbow, and nothing more than that, nothing
Exactly.
dramatic.
Looks 100 times better than before.
Yes, 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 yes. So you have got post-operative instructions, how to follow them, and you also have understanding to take a regular picture and send it to me for me to comment and so on. You've also seen the image of your elbow on the mirror and so on. How do you feel now, Nicholas?
Great, more confident.
More confident?
Yeah, because I've always been trying to hide it, but now it's gone, so I feel good.
Gone so far.
I feel a lot better.
Yeah, yeah. So I would like to see you back again in a week time, just to follow up. Everything is settling down, and we will, once it heals up, it will restore the normal skin color, the normal skin creases, and the texture and everything back without any scarring. That's the joy of the carbon dioxide evaporation of the warts. Okay?
Thank you.
Great.
Thank you. Thank you.
Thank you very much.
Thank you.